So another question that I often get asked is whether or not naturopathic doctors are opposed to prescription medications, vaccines, or surgery. A lot of people assume that because I'm a naturopathic doctor that I'm against medications or I'm against surgery or I'm against vaccines. And that's actually not true, at least not for all of us. Our training does include the judicious use of prescription medications. Our training includes vaccination schedules and things like that. And certainly, like, if something's broken and needs to be put back together, or if there's a tumor that needs to be removed, there are definitely times when surgery is the right thing to do, and the surgery will be removing an obstacle to cure or removing a cause of illness. So there are definitely times where prescriptions, I think, are absolutely part of the therapeutic order, and surgery is definitely the right choice. The difference between a naturopathic approach and a medical doctor approach to prescription medications or surgery or vaccines is not so much whether or not we think they should be done. It is that that surgery and prescription medications for naturopathic doctors are just two tools in a very large toolbox. So if we see a client or a patient and they have a particular set of symptoms, we will assess what we think needs to happen in the immediate. Like, is there danger? Do they need to be referred to another practitioner and be seen immediately for something that's urgent? If we've got time, can we help them get better with more benign, gentler tools like lifestyle change, diet change, or moving up the scale, homeopathy, and then herbal medicine, nutritional supplementation, things like that. Can we treat their pain with physical medicine? Can we collaborate with a chiropractor, an acupuncturist, and resolve their pain before they need something like surgery? So just sort of looking at all of those different options. So naturopaths see those options as part of a spectrum. We don't see them as something that should never happen, or at least most of us don't. The vaccine question is actually kind of a hot topic right now, and in truth, our profession is somewhat divided. There is definitely a subgroup within our profession that are not very that are fairly anti-vax. I think that our profession as a whole does feel that vaccines are important and have their place. So I'm not going to make a stand one way or the other about how naturopathic doctors feel about vaccines, because I think that the jury's still out. But doing vaccinations is definitely part of our medical training. So I can at least say that we are trained to administer vaccines. So that is naturopathic scope of practice.